Patients come to the Beaumont skull-based program for a variety of reasons. They are connected to a multi-disciplinary of doctors with different specialties.
We have neurosurgeons, otolaryngologists like myself, trained just in endoscopic skull-based surgery, and craniofacial surgeons.
And a lot of what we do involves approaches that are working together with other surgeons and other disciplines to come up with the most comprehensive treatment for the patient.
We work as a team. We would identify the pathology, and we will have the meeting among us to come up with the best surgical treatment and treatment plan for the patient.
I suffered a seizure October 19th, 2019 out of nowhere, and they continued progressively until I seen Dr. Zilga and the staff in February.
Mindy presented with a seizure disorder, and she was found to have part of her brain coming through a defect at the base of the skull.
So in other institutions, she would have had to undergo a large craniotomy with a big cut on her head and shaved hair, been in the hospital for a week, whereas what we could do through the nose with Dr. Jacob and myself is surgery through the nose. It's natural openings, so it's almost a painless surgery, and she was out of the hospital the next day.
It was phenomenal because I knew after the first time that I seen Dr. Jacob that when he sat down with me and said, "You have to have surgery, but we're putting that on the back burner until we figured out," I knew I was in the right place.
But we've certainly seen in patients like Mindy that when we take out the focus endoscopically, as we did with her, we can achieve really excellent seizure control in some of these very rare conditions.
So I think this program is special. We're purposely recruited to build this here.
We worked really hard here at Beaumont to build a very comprehensive skull-based program with the best subspecialists in the country.
So in order to tackle on pathology deep in the skull base, you need expertise as a neurosurgeon, as an endonasal otolaryngologist, and also reconstructive plastic surgeon to restore form and function.
So when patients are looking for places to go, I think it's important to look for a couple different things. One, are the doctors they're seeing capable of doing what they need to be done? Are they up to date with the latest technology, and are they comfortable doing it?
At Beaumont skull-based program, we adopt the technology to be able to identify and precision locate the tumor. And not only that, in order to provide reconstruction, we use the CAD/CAM technology to create a three-dimensional custom-made plate and implant to restore form and function for the patient.
We definitely have the best technology, whether it comes to radiation or endoscopic surgery, hearing preservation, vision preservation, all the different techniques.
I think having one of the only proton beam centers in Michigan is really important because some of these tumors do need radiation afterwards.
I mean, given our extensive experience, it's not uncommon. We get referrals from all over the country for very complex tumors and other skull-based pathologies where other neurosurgeons have recognized us as the experts in the country to deal with these problems in the most effective way.
So at Beaumont skull-based program, we assign the nurse navigator who will be the contact person.
Good morning, Sinus and Skull-Based Clinic. How can I help you?
I think it's also important to get to know our nurse navigator. I think she sets our program apart because patients are always saying how wonderful she is.
She took my phone calls, took my aggravations, all my symptoms, had questions, never said anything mean to me. Always said, "Don't cry, it's fine, we'll get through it."
I am a spokesperson for our patients. I do help them from the initial phone call all the way through their treatment plan. Patients who are surgical candidates to patients who are not surgical candidates, we are still there for them.
We do the surgery so often, but it's the first time the patient's going to have their surgery. So if we're staying late or coming in early, we have no problem doing that because we know what it's like to be with the patient.
I've been seizure-free since 2020, and I've just continuously have gotten better from there.
At Beaumont skull-based program, we provide a state-of-the-art medical care for the patient, but also we always treat the patient as part of our family.
What we do here at Beaumont with the team that we've assembled, along with Dr. Folby and Dr. Chayasat, really does bring the very best of skull-based neurosurgery that really the world has to offer. And we do it right here in Southeast Michigan.